Hello everyone, welcome at SudhirEyeCoach, a channel for budding ophthalmologists. Today I'll be sharing a video for tips to handle hard black nucleus. With experiences and with practice, we can develop the sense that we can handle this cataract through phacoemulsification. For the beginners, I would suggest go for safe small incision cataract surgery if you are not capable to handle, uh, if you're not well versed to handle hard nucleus through phacoemulsification. But with the practice, we can handle any grade of nucleus and we can perform safe phacoemulsification. Because the red glow is not there, so always stain the anti-capsule with Trypan blue, and definitely it makes the Capsulorhexis easier. Selection of viscoelastics is again very important because we have to somehow protect the corneal endothelium with the moving fragments of nucleus. Before starting Capsulorhexis, always think to get decent size Capsulorhexis. Try to make a Capsulorhexis as much as you can make it bigger. A large capsular opening gives better exposure to nucleus to handle through phacoemulsification, and complication rates goes down. Here the nucleus is big and tough, and it has very less amount of epinuclear plates. To try to do gentle hydro-procedures and try to separate the nucleus and the epinuclear plate, thin epinuclear plate from the capsule. Before phaco-fragmentation, fill the antechamber tightly with dispersive viscoelastics because it coats the corneal endothelium. Expose the tip and go in trench mode and try to create a trench in the nucleus, and then at the tip of the trench hold it with the vacuum, high vacuum, and change the phaco settings to phaco fragmentation settings, and then with the chopping and vertical technique you can divide the nucleus in smaller pieces. Do not try to do complete the phaco fragmentation with the larger pieces. Try to divide the nucleus in several smaller pieces. You can divide it in 6 or 8 pieces, and as you think that now it's safe to hold the nucleus fragment towards the center, then pull the fragment towards the center at the plane of iris and a capsular plane, and you can start the phaco fragmentation safely here. In this case, I keep on rotating the nucleus and try to divide the nucleus fragments in several smaller pieces, and then I held one piece and pulled it towards the center for the phacoemulsification. Now gradually you can hold the nucleus, try to chop and make it smaller, and then again complete the phaco fragmentation. Here you can change your phaco settings and select the quadrant mode where both modes work, and basically torsional uh, phaco makes the phaco fragmentation quite easy. Tip for the beginner is that try to understand the geometry of a nucleus before starting the chopping technique. You can here use divide and conquer because through the divide and conquer technique, when you prepare the trench, you can understand the thickness of nucleus, and then in future it becomes easier to chop the fragments. You can fill the antechamber again and again to protect the corneal endothelium with dispersive viscoelastics, and finally you can complete your phaco fragmentation without much of the efforts. Often phaco tubings get clogged during phaco fragmentation with the harder nucleus, so um, remove the clogging of tubes and then you can complete the phaco fragmentation. Epinuclear plate is quite thin and you can easily aspirate through irrigation aspiration tip through the cortical cleanup mode. Now you can see glistening posterior capsule and decent red glow. Use the PSS to flush out the cells and the sticky fibers on the posterior capsule, and here, after completing phaco fragmentation and cortical cleanup, I implanted single piece hydrophobic implant in the back. Tip for the beginner is that always try to understand about the geometry of nucleus. So this you can understand by making a trench, and you can assess that how much depth you need to divide the nucleus with the mechanical or uh, by manual technique. And when you understand about the thickness and geometry of nucleus, you can start mix the technique with the phaco, different techniques of chopping, and that definitely makes your surgery successful and fast. Thanks for watching.